Hey, this is Dr. Terry Spencer again. Part 3 of my series, The Patient Guide to Cataract Surgery, is to tell you that there are options when you have cataract surgery. So let's talk about what those options are. If you watched part 1 and part 2 of this series, you know that the purpose of cataract surgery is to remove the natural lens from inside the eye because it has become cloudy and is blocking some vision. Medical insurance plans will not cover cataract surgery if it is done for the sole purpose of getting out of glasses or contact lenses. There must be loss of best corrected vision or glare problems. Sometimes the cataract must be removed in conjunction with other medical eye problems. Patients without a significant cataract who still want to have the surgery to reduce their dependence on glasses may be a candidate to self-pay for the procedure. In that case, we call it a refractive lens exchange. This is the same surgery as cataract surgery, in that we remove your lens and replace it with one that can correct your vision. After the decision has been made on whether cataract surgery is appropriate, there are decisions to make on the planned outcome. Insurance providers pay for the standard kind of replacement intraocular lens, and the new IOL comes in different powers to help lessen the need for glasses after surgery. Your surgeon will implant the best power IOL specific for each eye. But the standard IOL does not change focus from distance to near focus. If a standard or toric IOL is implanted for best distance vision, then the eye is not in good focus for near vision unless reading glasses are used. Most cataract surgery patients choose the distance vision outcome, and they understand that they will need readers to see up close. This makes sense because if the patient loses their glasses, they could still potentially drive. There are some additional options that cost extra and are not covered by your medical insurance. These upgrade options require an additional out-of-pocket expense. Not all eyes are candidates for the different upgrade options. One option to help reduce the dependence on eyeglasses after cataract surgery is called monovision, where one eye is in good focus for distance and the other eye is in good focus for near. The standard type of lens implant does not correct astigmatism. If you have cataract surgery with a standard type of IOL and the eye has a lot of astigmatism, it will still need glasses after cataract surgery. Your cataract surgery will discuss the option to correct astigmatism by implanting a toric IOL. In special cases, astigmatism can still be corrected after the eye has recovered from cataract surgery with LASIK or similar procedures on the cornea. Multifocal IOL implants are designed to give each eye both distance and near focus. There are several different multifocal IOLs on the market, and they have a different underlying mechanism of action of how they work. Many of the most commonly used multifocal lenses are engineered to cause diffraction of light in order to create the distance, intermediate, and near focal point for each eye. There are several options and different surgeons have their own preference, so I won't get too specific in this video. There are always new technologies available as the industry continues to search for the perfect lens. If you watch a dozen different cataract surgeons on YouTube, you may see a dozen different techniques. You may have heard of a laser option for cataract surgery. Most ophthalmologists are excellent at cataract surgery and the complication rate is very low. Some surgeons like to use a femtosecond laser to help them complete certain parts of the cataract surgery. When we do cataract surgery, we must make tiny incisions in the cornea to reach the space inside of the eye where the lens is located. These incisions are customarily made with a precision blade made from steel or a diamond. This is a part of the procedure that can also be done with a laser. The laser may be helpful for some surgeons, but here is the bad news. Insurance does not pay for the laser part of the surgery because it does not make the procedure any safer with regards to complications. If you prefer to go to a surgeon who depends on the laser for their cataract surgeries, you will have to pay extra out of pocket. The laser can also help with other parts of the procedure, but the laser does not actually remove the cataract. The cataract is removed by a special instrument called phacoemulsification. In summary, when you speak with the surgeon about options, whether it is astigmatism correction, monovision, multifocal IOLs, or even the laser, they're going to spend some time making sure you have realistic expectations and that you understand the risks and benefits of each of these options. Cataract surgery in itself is for the purpose of improving vision by removing the cataract, but the insurance company does not guarantee that getting out of glasses is part of the process. If a patient wants to be less dependent on glasses, then there are some options to discuss. But no option no matter how expensive, is guaranteed to give the same kind of vision outcome as that of a 30-year-old fighter pilot with perfect vision. Now you know that there are options when it comes to cataract surgery. Make sure to speak with your surgeon about what options are best for you and to find out how much they cost.